Hi, my name is Kirsten and this is my medication administration video for NU311. This is my batch, and this is the room that I'm in, just our dining room. This is my workstation, and I'm gonna begin. So, to start off, I am in the medication room. According to hospital policy, this is a no interruption zone. So I would keep the door closed. I would not take any phone calls and limit conversations to only essential information. So the first thing I'm going to do is I have my patient care order form and my medication administration record. I'm going to compare these two. So my patient is Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. They have an allergy to penicillin. The medication is morphine sulfate. On here, medication is morphine sulfate. The dose is 5 milligrams on here. The route is intramuscular. The timing is every 4 hours. The indication is PRN for pain. And the correct documentation would be that I would just make sure that all elements of a legal prescription are included in this. So now that I have verified the accuracy of both of these forms, I'm just going to set my patient care order form to the side and just go off of my MAR from now on. So I'm going to wash my hands, and then I'm going to begin my first check for accuracy. These are the 7 rights. So my right patient is Jaguar J. Jones, medical record number 417-6352, allergy to penicillin. My drug is morphine sulfate. Here I have a vial of morphine sulfate. I'm going to check the expiration date. It expires 12/20/2025, and we're well within the state, so this is safe to use. My correct dose is 5 milligrams. This is given as 10 milligrams per milliliter. So to get 5 milligrams, I would do 0.5 milliliters. So this is the correct syringe to use. Just open this up. And in order to drop the medication, I would use a blunt plastic cannula. My trash can is over here. And I would clean the top of the vial of our medication. I would start from the innermost area to the outermost. And I'll throw this away. So now I know that my correct dose is 5 milligrams, which is 0.5 milliliters. So I'm going to draw up 0.5 milliliters of air into my 3 milliliter syringe. I have already cleaned my vial, so I will remove the cap and place it here. I will insert the syringe into the vial using lots of pressure. I will inject the air into the vial, and then I will draw up 0.5 milliliters of morphine sulfate. All right. Now I'm going to use the scoop method to recap my syringe in the blank cannula. So I'm going to put a hand behind my back, just like that, and click it on. And now I'm going to I'm going to verify this with another nurse because this is a high-risk drug. This is morphine. So I would check my correct dose. This is 0.5 milliliters. And I would verify this with another nurse. And then now my right route is intramuscular. So I'm going to select the correct needle for an intramuscular injection. So I will be using this 23 gauge needle. Yes, that's right. So I'm going to remove the blunt cannula and place this in my sharps container. And then I'm going to apply my needle to my syringe. Twist it on, throw this away. So now I have the correct needle and the correct syringe to give this medication. Now the timing, the right time to give this medication is every 4 hours. I know that it has been longer than 4 hours since they last received this medication, so this is an appropriate time to give it. The right indication is PRN for pain. We know that our patient is in pain, and we also know that morphine sulfate is a pain-relieving medication, so this is an appropriate medication to give under these circumstances. And then correct documentation would be that all the elements of a legal prescription are included. So now that I have my medication drawn up, I'm going to move to my second check for accuracy, which again are the 7 rights. So my correct patient is Jaguar J. Jones, medical record number 4176352, allergy to penicillin. My right drug is morphine sulfate. I have my vial of morphine sulfate, and that's also what's drawn up in my syringe is morphine sulfate. My right dose is 5 milligrams, which also translate to 0.5 milliliters. And I have 0.5 milliliters in my syringe. The right route is intramuscular. This is the correct needle to use for an intramuscular injection. And for intramuscular, I can inject the needle at a 90-degree angle. And then the right time is every 4 hours. So I know it's been longer than 4 hours, so this is a good time to give this medication. The right indication is PRN for pain. Again, our patient is in pain, and morphine is a pain-relieving medication, so that is the correct indication to give this drug. And then our right documentation, all elements of a legal prescription are included, and this is also when we would create the label for our medication that we're going to be giving. So I am going to make my label. On our label, we're going to write our patient's name, Jaguar J. Jones. The drug is morphine sulfate. Morphine sulfate's in here. And our dose is 5 milligrams, which is also 0.5 milliliters, and we have 0.5 milliliters in our syringe. 0.5 milliliters. So now we're going to apply this to the end of our syringe to correctly document this. All right, so our syringe is correctly labeled. This is the correct documentation for this syringe as well. So now that my second check for accuracy has been done, I'm going to move to my patient room. So I'm going to take these things and go to my patient room. Just right here. Okay. This is my sharps container. I'm going to move you so you can see my patient. So my sharps container right here. Okay. So I would enter the room and I would say, "Hi, Mr. Jones, my name is Kirsten Joyner. I'm a student nurse here at South. I'm going to be giving you your morphine injection today. Is that okay?" All right, well, I'm going to perform my hand hygiene. And before we get started, I'm just going to perform the 7 rights and make sure everything's looking good, okay? All right, so our right, first I'm going to identify you as well. So I've done my hand hygiene and now I'll identify you. I'm going to use 2 identifiers, Jaguar J. Jones, medical record number 4176352, medical record number 4176352. And he does have an allergy to penicillin, and as it says here on his armband, he has an allergy to penicillin. All right, Mr. Jones, are there any other allergies that I need to be aware of today? No? Okay. So now I'm going to do my third check. So my right patient is Jaguar J. Jones. Jaguar J. Jones. My right drug is morphine sulfate. I have my vial of morphine sulfate, and that's what's drawn up in my syringe, morphine sulfate. My right dose is 0.5 milliliters or 5 milligrams, and I have 0.5 milliliters in my syringe. The right route is intramuscular, and this is the right needle to use for an intramuscular injection. And then when I select my site for intramuscular, you can insert the needle at a 90-degree angle, and I'm going to choose the ventrogluteal site today. The right timing is every 4 hours. It's been longer than 4 hours, so this is a good time to give you your medication. And the right indication is PRN for pain. I know that you're in pain. Morphine's a pain relieving medication, so that is appropriate to be giving you today. And then the right documentation, all the elements of the legal prescription are included, and this is correctly documented as well on my syringe. All right, Mr. Jones, so I'm going to be giving you your morphine injection today to relieve your pain. I'm going to perform hand hygiene one more time. I'm going to raise your bed up, I'm going to lower your side rail, and then I'm just going to position you comfortably, all right? So I'm going to position you on your side because I'm going to give you your injection right here in your hip on your ventrogluteal site. So I'm going to have you just lay on your side like that. Perfect. All right, so the first thing that I want to do is just assess the patient. I would check vital signs, heart rate, blood pressure. I would assess the area that I'm going to be injecting for bruises, blistering, any lumps underneath the skin. If any of that was there, I would just select a different site. So now that you're positioned comfortably and I've explained the procedure to you, I'm going to don my clean gloves. And I'm going to put on my goggles. All right, Mr. Jones, I'm going to get ready to inject, all right? So I'm going to clean the site. The site that I'm going to be injecting is the ventrogluteal site, so I'm going to make sure to identify the landmarks of that site. So the landmarks for ventrogluteal, I would locate the greater trochanter, which is right here on the hip. I would locate the iliac spine and the iliac crest, and I would use the V method and inject the needle in the center of the V. So I'm going to just clean the area that I'm going to be injecting, starting from the innermost portion and moving outward to the outermost portion. All right, I'm going to leave this right here. I'm going to put the corner pointing to where I'm going to be injecting. And then next, you can see, I'm going to be taking my syringe and my needle. I'm going to open up my needle. I'm going to spread the skin and inject the needle at a 90-degree angle. All right, I'm going to aspirate. All right, I don't see any blood, which means I can continue to inject very slowly. I'm going to pull straight out, go right into my sharps container, and I'm going to apply firm, gentle pressure. All right, Mr. Jones, how are you feeling? Good. All right, so I'm going to throw that away. I'm just going to take off my gloves. I'm going to perform hand hygiene, and I'm going to reposition my patient comfortably. All right, Mr. Jones, you feeling okay? You're not having an allergic reaction or anything, which is good. Is there anything I can get you? I'm also going to lower the bed to the lowest position and raise the side rail again. All right, since there's nothing I can get you, I'm going to go outside and document my findings, and I'll be back in 15 minutes to check for an allergic reaction or anything like that, okay? All right, And then I would go to the nurse's station and I would document the procedure, the injection that I gave, morphine sulfate, and I would document the patient's response to the medication. And I'm also going to perform hand hygiene one more time. And this completes my medication administration checkoff.